A couple of weeks ago, the Imam of our local mosque in Hyde turned up at the surgery, and he wanted to be able to use the services in the practice, and he wanted to know about how he could order prescriptions. And he'd signed up for access to his records, but he wasn't sure how to make it work, and he didn't know what to do about it and things. And so you can see a picture there on the left with me and him. And I was able to sign him up for the access and show him how to do it on his mobile phone. And then we both talked about it and said, wouldn't it be great if we could try and help other people in the community, patients of ours, and also not just our patients, but patients in other practices as well, so that they could also be able to do the same things as what he was able to do, and he thought that was a wonderful idea. So we said, well, what should we do about it? And he said, well, why don't we have some sort of meeting where we can talk about these issues and help people who've not got access to their records so they can sign up for it and gain a better understanding. So there's a picture of the Imam and myself in the clinic, and then Shafia, you came along as well.
Yes, I did. Yeah.
So,
well, I came in so that Dr. Hannan is he has advertised through Imam to the mosque. So I thought I would volunteer, so Dr. Hannan organised this group, so where people can access, get registered to access their health record.
And of course we did it with the PPG and patient participation group, so we talked to Ingrid. And do you want to say that in Bengali as well?
আমি ডাক্তার ইসলাম বাদে গিয়ে ডক্টর হান্নানে কইছেন যে আমারে ও গ্রুপ অ্যারেঞ্জ করা যে মসজিদ আতরাইসিং করছেন ইমাম আইবা আর কমিউনিটির মানুষ আইবা আমি তারে হেল্প করতাম ও এখন আমরা হেল্প করবো তারে কিলা অ্যাক্সেস টু হেলথ রেকর্ড ও জানি না কিলা ইনফরমেশন দেবো.
And so the Imam then announced it in the mosque, and on a Friday at prayer time we get about maybe 1,000, maybe 1,500 people. So he was able to announce everybody in that audience that this meeting is happening. And what's important is that because he's a community leader here, he's able to engage with very many more people. And what I found as a GP was that subsequently people who were coming to see me had heard about this meeting and were really pleased about it and wanting to know more about how they can do it as well.
মসজিদ অ্যানাউন্স করার পরে আপনি বন্ধুকে এখন 1000 থেকে 1500 মানুষ আছে মসজিদ, তারা জানিয়া ইয়া কইছে যে ভেরি গুড আইডিয়া যে এটা করা এগুলো সবাই জানা উচিত এবং তারা সকলকে বেনিফিশিয়াল.
And it was his idea to actually do it here in the surgery, and what's important is that it's someone from the community who's actually asking for help to support local people.
Imam mane korse je very good idea
to support local people.
Again, community mention again support or again support like that.
So, what's it all about? And it's not about seeing the doctor or trying to get an appointment, because there's a statement here from Nelson Mandela who says, education is the most powerful weapon which we can use to change the world. And what do we mean about that? What kind of education, and what is it that people can learn to help themselves? And I love this quote from Winnie the Pooh, where Piglet says, how do you spell love? And Pooh turns around and says, you don't spell it, you feel it. And those of you that are watching this today and hearing it today, and we start to think about it, it's not the actual words that matter, it's not the letters on the page, it's how you feel as a result of being able to see what your doctor or nurse has written, understanding what's happening, and you feeling as though you're part of that care and you're a driver in that care and not just having things done to you. Maybe struggle. Yes. So something about feeling rather than just spelling. It's a difficult one. Okay, so we'll keep going. So why does all this matter? And this was a study that was done by Age UK earlier this year, and it's asking the question where older people in England get their help from. Now, 12.5% of elderly people pay for their own care. 21% reach out to the council, and the council with public services helps. But as you can see here, 30% of elderly people don't get any help at all. They're on their own, helping and having to do things for themselves. And then another 37.5%, so more than half of elderly people are relying on family and friends and themselves. And I think moving forwards over the next few years, as the challenges that we face, more and more people are going to be expected to do more for themselves rather than expecting someone else to do it for them.
Okay, so council helping for 21% measure and nije share 12% measure gary help nije paying for and 30% people are couldn't help now and 37.5% measure in family and friends gary help.
So the question is, how can we help each other to support the care?
Okay, so I'm regularly like an example help for them.
Now here's a lovely picture of me and Ingrid in the consulting room. And of course, as a patient, when you come to your doctor or nurse or pharmacist or whoever, you're coming to ask for help because it's something that you might be concerned about or worried about around your health. And you're telling us what that problem is, but you're expecting that doctor, that nurse, that pharmacist to try and deliver the best healthcare possible. Of course, we don't work on our own, and when we type your name into the computer, your health record comes up and it shows what problems you've got, what medications you're on, and what allergies you might have, consultations you've had, letters and test results.
Okay, so doctor doctor khali matrana recorder ma jo ye jaida dekha computer apne kita ase so itu gari boja usse takhe.
So if that record can help the doctor or the nurse to give you the best care, imagine if we could turn that screen around so that you as a patient could also see the same information that's about you, so that you can read it in your own time and understand it better and not try and have to remember everything yourself.
I can record the care and I can shop this monora halakona I can tawani ku dekhiya bar dekhta pada hitta pada janta pada mujhe kita और doctor ke side ta pada care kichu consultation.
You're trusting the doctor or the nurse to help you get the best care possible, but we also want you to tell us as much as what's wrong with you so that we can help you. And by sharing that record and helping you to understand it, we build this partnership of trust. It's a trusting relationship that we have between us. And it's not really about just looking at your record, but it's about you helping yourself and getting the best care for you and your family. So we have a practice website, and this allows us to and share the information that we've got with all our patients and in fact with anybody around the world. So this is our practice website. And what we're now going to do is show you how you can also get full access to your medical records if you're a patient of ours. Down the left hand side, under here, we've got register now.
So Hanna can get it online access for the program. Nise after uje jakno dekhaison ogo gari ohana gari full access record gari register korta.
And when you click on that, then you can see a little video of myself explaining what's needed, and it's a two-step process. You get
Okay, so Hanna gari I can uje under surgery maje but Hanna le ohana uje ekta video ase for dekte parba kila non duita step ase to register eta online questionnaire complete kora.
You have to come to the surgery, to the front desk, and speak to the reception staff and ask them for your PIN numbers. We can't email that to you or tell it you over the phone. Surgery reception PIN number phone email. And that's because this is your very personal information and we want to make sure that nobody else can access it.
Personal information.
And that's why we don't email it or do it over the telephone. And once you get your PIN numbers, if you click on that button there, you can then register your PIN numbers.
So if PIN number 5 there, PIN number register for
and then the second step is a little questionnaire that we do to check your understanding of what you're signing up for.
Second section is
and that's what we're going to do now.